Hey, Margie here. One of the most important pieces of the puzzle when it comes to osteoporosis is testing. And by testing, we can figure out what we're dealing with because this is not a one-size-fits-all situation. Last year, I did a podcast with Dr. Kim Millman on the essentials of lab testing for bone loss. And so many people thanked me for this because it was so helpful to them in their treatment. So this year, Dr. Millman is back and she's updated the information to include advanced cardiovascular labs. So what this is today, it's a webinar that she created with all of the testing. And there's just so much great information. I'm so excited. But let me tell you a little bit about Dr. Millman. Dr. Kim Millman she's an MD, PhD, and she's a Stanford, UCSF, USC trained functional medicine physician and research scientist. She has over 30 years of functional medicine training and a thriving private practice in Silicon Valley. She has specialized in osteoporosis for over 16 years. Dr. Millman and I also teach a course called Restore and Rebuild, 100 Days to Healthier Bones. Dr. Millman uses dietary, lifestyle, and root cause solutions to address chronic disease. Her mission is to help women with thin bones by using a personalized, holistic approach to strengthen their bones so that they can live a long and active life without the worry and fear that they may break a bone and lose their independence. And in this webinar today, there is so much information that you can put into your life to really help you figure out your path forward. So stay tuned. Welcome, Dr. Millman. I'm so happy to have you back on the podcast. And this is such an important topic. You know, it's through testing that we figure out root causes and then we can make progress. And there's just no one better to really discuss this since you've been doing this with osteoporosis, is looking at it through an integrative approach. This is over 15 years and you've gotten such great results and it's just so exciting. So welcome.
Yeah, thank you. It's my pleasure.
Yes. So today what we're going to do, Dr. Millman has already prepared this really phenomenal webinar she put together with really going over all the testing. And what I think is so wonderful this year, and we're going to talk about that in a minute, is that you've added what people need to do to look at their heart health, because this is not something typically when we're discussing osteoporosis that people even correlate, even would think about together. You know, yes, as women get older, they care about their heart health, but it's not something that we even think, you know, that usually goes along with osteoporosis. So I'm so excited that you added this piece. So you want to just share how this came about? You know, how did you even, and when one thing you have to know about Dr. Millman, when you investigate something, you don't just do, you know, let's look at a few articles. You do a deep dive, which is so incredible because then you can really put the pieces together. So why don't you share with everybody why heart health, you know, why you even asked me about that, you want to present this year about heart health?
Well, first of all, I think that most of us know that cardiovascular disease is the number one killer of both men and women in the U.S. So, of course, it's something that all of us have to keep in mind when we get to a certain age. And so we want to focus on prevention. But not many people really know that when you have bone loss, that makes you actually more likely to have cardiovascular disease, to have a cardiovascular event like a heart attack or stroke, or to die from cardiovascular disease. And this is completely irrespective of traditional cardiovascular risk factors. Just the mere fact that you have bone loss makes you more likely to have cardiovascular disease. So I think that is something that was actually surprising to me. And once I realized and understood that, then I knew that I had to understand where the links were coming from and how we could test in order to, again, figure out where in the pathway can we intervene so that we can prevent and also have this opportunity to improve our bone strength and the resiliency of our bones.
So, you did such a good job, and so many people thanked me for your talk on the summit where you talked about heart health. You want to just give I couldn't get over some of the statistics you shared. And, it's something that's just not talked about. So can you just go a little more in detail about these things?
Yeah, absolutely. So there was the MESA prospective study. So this was a study that looked at, they were looking at whether or not what percentage of people had a coronary artery calcium score over 0. So what this implies is that a person has plaque that is measurable in their coronary arteries, in the arteries of their heart. And when they looked at the normal bone mineral density group, 36% had a coronary artery score over 0. In the osteopenia group, it climbed to 49%. And in the osteoporosis group, it climbed to 68%. And so that was showing that the more bone loss you had, the more likely it was for you to have measurable plaque in your arteries. So that was an important study to look at. And so then that's indicating that the more bone loss you have, the more cardiovascular disease you have. And then in the MORE trial, and this was looking at U.S. postmenopausal women with bone loss, and they were showing that these women had increased risk for cardiovascular events like heart attacks and strokes. So when you compare someone with osteoporosis to someone with osteopenia, they had almost a 4 times increased risk of having an event. And then when you looked at whether a person had at least one vertebral fracture compared to no vertebral fracture, they had almost a 3-fold increased risk. So then this is showing that U.S. most postmenopausal women, if the more bone loss you had, the more likely it was going to be that you would have an event, a cardiovascular event. And then lastly, and there were many more studies. I've just picked out a few just to give you a few of the statistics to show that, to illustrate what I'm talking about. So then there was the study of the osteoporotic fractures, and that showed for every standard deviation decrease in the bone mineral density at the hip, this was associated with a 30% increase in mortality from cardiovascular events. And in the study of osteoporotic fractures, they showed that for each standard deviation decrease in the bone mineral density at the hip was associated with a 30% increase in death rate with from cardiovascular disease. And so let me give you an example of this. If someone had a T-score of -1 compared to someone who had a T-score of -3, that's 2 standard deviations. So that would be 2 times 30%, and they would have a 60% increase in death from cardiovascular disease. And also in that same study, a vertebral compression fracture was associated with a 2 times increased risk of cardiovascular mortality in postmenopausal women. So you can see just in these 3 examples, as bone loss progresses, your risk of having cardiovascular disease, having an event, and it dying from cardiovascular disease goes up. So, and this is completely irrespective of all of your cardiovascular risk parameters like hypertension and lipids. So I thought that this was pretty dramatic and actually surprising information.
I think it's so important because now, and as people listen to the rest of your talk, we can test for it and we can see, we are at further risk and what can be done, because that's the good news. It's not as though, oh no, oh poor me, there's things that can be done. So I think this is so important. And really, And I've been working with osteoporosis for so many years, and up until you brought this up, Dr. Millman, no one's really ever made this correlation, even though it is in the research. So I'm so grateful for you for doing this, because lives can be saved. So thank you. I also thought when you came on the summit, you talked about that there are some shared risk factors between osteoporosis and heart disease. And I thought that was so interesting. Before we get into the webinar and testing, you want to just share a few of those?
Yeah, sure. And there are some absolute non-surprising risk factors that are shared between like a bad diet and being sedentary, and several other things. But some of the ones that were surprising to me, and these were risk factors that linked these two metabolic processes. They included low sex hormones, so low estrogen, low testosterone. Inflammation and oxidative stress are actually pretty obvious. A leaky gut was a little surprising to me. Vitamin D and vitamin K deficiencies link these two metabolic processes. Blood sugar dysregulation. And one of the ones that was particularly interesting to me was hypertension and high cholesterol. Of course, we understand that hypertension and high cholesterol is absolutely related to cardiovascular disease, but how does it relate to bone loss? And while I think that a lot of people understand that hypertension and high cholesterol are related to cardiovascular disease, they probably don't realize that hypertension can actually increase your fracture risk, and low HDL, the good cholesterol, can cause increased bone breakdown. And the other thing that was really interesting is that the mechanisms by which these two metabolic processes occur are very similar. So the mechanisms in that cause vascular calcification are very, very similar in what causes bone breakdown and what causes bone formation. And that was fascinating as well. So I actually thought it was important to update the lab testing webinar to include some advanced cardiovascular testing so that people can better understand their cardiovascular risk and take advantage of an overlooked opportunity to improve the strength and the resiliency of their bones.
Oh, I love this. And so what you're going to hear now is a really amazing webinar that Dr. Millman did, really going through, because that's the thing. Everybody asks, well, what test do you do, Dr. Millman? And so that's why she put this webinar together, and she's done this numerous times for my community. And, it's really helpful to share this on the podcast, because this is the beginning. If you don't test, you don't really know what are your root causes, and then you're sort of treating in the dark. And I think that's what makes this integrative approach so effective, because we can pinpoint what are the root causes, treat them, and as you and I both know, this is a big piece of it, and people get better and bones improve, and it's just such a win-win situation. So what we're going to do now, I'm going to switch it over to this amazing webinar that Dr. Millman did, and then we'll come back at the end. But I just want to tell people, because there is an incredible tool that you created. So when you're listening to this, don't worry, don't feel you have to take everything down. You want to just share with everybody what's available to them?
Yeah, so I've developed what's called an interactive testing tool, and that has been I've gotten rave reviews about this. So valuable to my patients, and so what it is that you have an opportunity. There's a list of the basic labs that I do that you can get at LabCorp and Quest. So these are blood and urine tests. And you can input your values, and you can input the date that you did your testing, and it will show you the optimal range that test should be in, and not just the normal range, but the optimal range, so you can see where you are compared to optimal. And then I also give you an idea if it should be repeated or not, if that's something that you should be repeating Some things you can repeat once a year, 6 months, 3 months, compared to according to whether it's non-optimal or optimal. And I've got that in the algorithm. So, and then what you can do is that you can print it out, and then you can have a list of all the things that you need to repeat for your testing. And you can keep really organized that way. And it also teaches you your optimal ranges. And sometimes you don't have a functional medicine doctor like myself to help you through that. So I think that tool is really super helpful. You get that for free.
This interactive testing tool is really fabulous. I'm so grateful for you for creating it because it's really helped so many people. So why don't you just share the link, since it is free, that people can just go to get this?
Yeah, sure. It's over at my website. So that's themillmanclinic.com/bones testing.
Okay, perfect. So now I'm so excited again to go through. And even though Dr. Millman has been on the podcast before, I wanted her to include everything in the webinar. So you have it in one place. You don't have to listen to this, go back to the, webinar she did last year. Everything's together. And I think these tests are so important that it never hurts to hear about them again. And then we'll come back afterwards. So enjoy the webinar, and we'll see you in a few minutes.
Welcome to the Essential Lab Testing for Unbreakable Bones webinar. The type of lab tests we'll cover today includes standard tests that your doctor might already be getting for you at a traditional lab like LabCorp or Quest. These are tests that you might even be doing in a yearly physical. The second type of tests include tests that your doctor may not order, but you still could get through a company like LabCorp or Quest. And they tend to dig a little deeper. They might be specific to the bones. And I'll give you an example. Your doctor could order glucose for looking at your glucose metabolism, but not an A1C and not an insulin. So those would be deeper tests that we could still get through LabCorp or Quest. And the third type of testing includes functional lab testings. And those can include looking at food sensitivities, at your cortisol and hormone levels, and taking a deep dive into gut health with microbiome and digestive analyses. These are all tests that I do in my private practice with my patients, and these tests we review in my signature program called Restore and Rebuild 100 Days to Healthier Bones. Let's look at many of the root cause tests I offer my patients in my clinic for those with bone loss or who want to improve their overall health. Bone turnover markers are done to determine how quickly your bones are turning over. C-telopeptide, or CTX, measures how fast your bones are breaking down. And propeptide of type 1 collagen, or P1NP, measures how fast your bones are building. It's important to understand their absolute values and how they compare to one another. They're helpful to measure at baseline, and then as you progress through a treatment regimen to assess whether things are working. They can also guide you towards which possible root causes could be a priority for you. Both are blood tests done by LabCorp and Quest, but it's imperative that they be done properly. They need to be fasting, done as early in the morning as possible, with no biotin, collagen, or bone broth, or intense exercise for 48 hours before the tests. It is essential for people with bone loss to be ruled out for both hyperparathyroid disease and a renal leak. Hyperparathyroid disease is when the parathyroid glands are too active. There are 4 rice-sized glands that sit on top of the butterfly-shaped thyroid gland. In order to rule out hyperparathyroid disease, we get a calcium, parathyroid hormone, and a 25-hydroxy vitamin D level. A renal leak is when the kidneys don't reabsorb the calcium like they should, and you lose too much calcium from your body. In order to rule this out, we get a 24-hour urine calcium test, and it is very important that this is evaluated without taking calcium supplements for 3 days prior to your tests. These tests are available from LabCorp and Quest, and these are tests that are routinely done for people with bone loss, either from your primary doctor or an endocrinologist. Many nutrients are important for strong bones, including calcium, magnesium, vitamin K, zinc, boron, phosphorus, and B vitamins. Most of the time, levels of minerals in the blood do not accurately reflect tissue levels, so I don't typically measure them. The vitamin D is accurate in the blood, and it's important to measure this once a year. And then there's something called MCV and homocysteine, and they can be very helpful to evaluate in order to know proper B vitamin status. Oxalates are anti-nutrient to the bones, and we have an entire bonus module on oxalates in the program. But briefly, oxalates are like little shards of glass, and they come from plants, and they embed themselves into tissues, causing pain and inflammation. But importantly, they deplete calcium, magnesium, potassium, phosphorus, zinc, and B vitamins, which are the essential bone nutrients. It may be helpful to measure a 24-hour urine test for oxalates and for citric acids, especially if you have symptoms of oxalate toxicity or a high oxalate diet. Hippocrates said 2,500 years ago that all disease begins in the gut. We take a deep dive into gut function with the functional medicine test, the GI map. Not only does it evaluate the balance between your friendly and unfriendly organisms in your gut, but it also looks at intestinal markers like your ability to break down fat and proteins, how inflamed your gut is, and how much leaky gut you have. If you have any GI complaints like pain, constipation, diarrhea, bloating, heartburn, and especially if you have an autoimmune disease, a GI map can be very helpful, and I would consider it to be a priority. Gut issues do cause systemic symptoms as well as gastrointestinal ones, including aches and pains, headaches, brain fog, and mood problems. I like all my patients with bone loss to do a GI map. This section of the GI map shows you the levels of friendly bacteria in your gut. Even though these are friendly bacteria called commensal or keystone bacteria, you don't want too many, so you want your levels to be in the green zone. This section of the GI map shows bacterial overgrowth. Not only does the GI map show bacteria, it also evaluates for pathogens, H. pylori, yeast like Candida, protozoa, and worms. Blood sugar and insulin resistance can cause an increased fracture risk. We dive deep and not just look at fasting glucose, but also A1C, insulin, HDL, and triglycerides. Ideally, you would get these yearly or more frequently if yours are not optimal. Continuous blood glucose monitors can help you in real time see how your sugar reacts to foods, and I recommend them frequently to my patients. Not only can you find your kryptonite foods that drive up your sugar time and time again, you can test several blood sugar hacks to see if they effectively flatten your blood sugar swings. You may want to get a continuous blood glucose monitor if you have high fasting insulin, glucose, or A1C levels, or symptoms of blood sugar instability. Inflammation is an obvious root cause of bone loss, and we measure highly sensitive CRP. This is a sensitive marker of inflammation, and when high, you know there is systemic inflammation. If it is not high, there still may be inflammation. Many of the inflammation markers are research-based, and we don't do them in practice. Hormone deficiencies are a major reason for bone loss. It's a good idea to get baseline hormone levels to know where you stand. Consider hormone testing if you have bone loss or symptoms of low hormones, including brain fog, insomnia, hot flashes, achiness, and more. There are various options for hormone testing. You can get blood levels. They are the least expensive. They are good for following hormones, and insurance may cover them. I like this option for postmenopausal women who are more than 6 years out from their final menstrual period, as it's likely that their hormones will be predictably very low. You would want to make sure to get a sensitive estradiol if you were a postmenopausal woman or a man, and a sensitive testosterone if you were a woman, and DHEA sulfate. Saliva levels are good for a baseline, gives you cortisol testing, but is not good for following hormones. When I do this for a baseline saliva or cortisol level, I use the ZRT Female Hormone Panel 3. Dried urine is the most expensive and most complete. You will also get a cortisol pattern, and it's good for following hormone replacement. I recommend the Dutch Plus for this purpose. I will often have one of my patients get blood to start with, and then if they do hormone therapy, follow with a Dutch. You can also get the cortisol pattern or the cortisol awakening response from the Dutch test people. Here's an example of a saliva hormone panel. This is a CRT female hormone panel 3. These are age-adjusted charts. So you can see that the green line is the optimal values, and the top red line are high levels, and the lowest red line are the low values. And so for this patient, she had a low estradiol, progesterone, and testosterone, and her DHEA was also low. These tests are easy to interpret, but not good for following hormones. They're not very expensive, and they also include cortisol. This is an example of a dried urine test for hormones called the Dutch test. And I'd like to show you that you have a dial for the big sex hormones, the estradiol, progesterone, and testosterone. And the purple box is the postmenopausal range. And the first yellow star is the premenopausal range that goes into the second gold star. And that is the end of the premenopausal range. And this would be high. So in this example, this patient had low estradiol, progesterone, and testosterone, and her DHEA was also low. The nice thing about this test is that you also get hormone metabolites, which can give you some idea of whether you are detoxifying hormones in a healthy way. It is something I do with my patients who are on hormone replacement therapy at least once a year. High levels of the stress hormone cortisol can break down your bones very quickly. Stress is common and is a major contributor to illness and decreased quality of life. Consider getting cortisol testing if you have bone loss or symptoms of high stress and cortisol like anxiety, insomnia, heart racing, palpitations, irritability, and more. So your cortisol testing options include the ZRT Panel 3, which is the least expensive, it is the least comprehensive, and it's the easiest to interpret, as well as the Dutch Plus, which is the most expensive, the most comprehensive, and is a little harder to interpret. It gives you something called the cortisol awakening response. And this is really important because it shows how the communication is happening between your brain and your adrenals. And this is a very important part of being able to profile where your cortisol and your hypothalamic pituitary adrenal axis is. This is an example of a ZRT female hormone panel 3, and you get this in addition to getting your hormones. And in this example, the patient had a high normal cortisol at night, and it was likely responsible for her not sleeping well. This is an example of the Dutch Plus, and this is the salivary cortisol section. This is the cortisol awakening response that I talked to you about. And this is comprised of 3 values, which includes waking plus 30 minutes, and waking plus 60 minutes. You can see how this cortisol pattern optimal should be right in the middle of the 2 gray dots, and you can see how she's starting off low as she wakes up. She's optimal at 30 minutes, and then she stays high at 60 minutes. So this would be an example of a high cortisol awakening response. And this is indicating that she is in sympathetic dominance or fight or flight a high percentage of the time. She also had high normal cortisol at night, and this is probably one of the reasons that she was not sleeping well. This is a different example of the cortisol section of the Dutch Plus, and it shows a very different car that is relatively flat. And when a car is flat, this is showing cortisol resistance, which means that there's miscommunication between the brain and the adrenals. And so what this means is that the brain is not sending an appropriate signal to the adrenals to make cortisol. And so you have a flat cortisol curve. In this case, adrenal adaptogens can be really helpful to reestablish that communication between the brain and the adrenals. So it is really important to look at your heart health. And there is an intricate link between heart health and bone loss. And in fact, those with bone loss have increased risk of cardiovascular disease, events, and mortality, irrespective of their cardiovascular shared risk. And also, there are shared risk factors like hypertension and dyslipidemia. These are and oxidative stress and inflammation. So this gives you an opportunity to look at your cardiovascular risk profiling and get a more advanced assessment. So that's what I am also teaching in the Restore and Rebuild 100 Days to Healthier Bones. So one of the tests that we look at, there's some genetic testing. One is lipoprotein A, or LP little a. So this is a truck that trucks around your LDL cholesterol. And when it goes up, your risk for cardiovascular disease and events and mortality goes up with it. So what's important is this is one of the single most important genetic risk factors for cardiovascular disease, and it is largely genetically determined, and it is usually very unaffected by lifestyle. So this is an important one to know, because if your LP little a is high, you know that all the other cardiovascular risk factors, you have to be even more diligent at minimizing them. Apolipoprotein E, or ApoE, this is another truck for your cholesterol and triglycerides. There's 3 genetic forms, E2, E3, and E4. And each one of the genetic SNPs, or pieces of genetic material that put together as a protein, there are 2 what's called alleles. And the alleles, you would have a combination, you could have a combination of the E2, the E3, and the E4 alleles. And there would be 6 different combinations. So E2 with itself, and E3 and E4, and then E3 with itself, and E3 with E4, and E4 by itself. Those are the 6 combinations. And then these different combinations are associated with different risks of either higher cholesterol and also your response to saturated fats.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show.
We also like to dive in deep and do advanced lipid testing. So in addition to standard lipid testing, including total cholesterol, LDL, HDL, and triglycerides, we look at LDL size, LDL particle number, small LDL particle number, HDL particle number, and HDL size. We also look at apolipoprotein B, and this is another truck for your cholesterol and triglycerides. And in fact, it's a better predictor of your risk than just your LDL and non-HDL levels. Oxidative stress is often the initiating event to plaque formation and many cardiovascular events, and it is lifestyle related. We measure oxidative stress as it applies to the heart with F2 isoprostanes, which is the gold standard for measuring oxidative stress in the body. And we also look at oxidized LDL, and this measures the amount of LDL that has oxidized and that has the potential to form plaque. We assess plaque growth and plaque initiation by measuring molecules called ADMA and SDMA. And when these molecules are high, they both indicate a lack of nitric oxide. Nitric oxide helps blood vessels to be elastic and dilated, which helps to keep your blood pressure down, and it also decreases cardiovascular events and cardiovascular mortality. We also measure microalbumin, and when it's high, we see this as one of the first signs of endothelial dysfunction, and that's what we call a leaky blood vessel. HSCRP, which we've previously discussed in the inflammation section, is also related to plaque initiation and growth. We also do lab testing that can indicate vulnerable plaque, and we look at LPPLA2, and this is measuring inflammation within the arterial wall, and this would be below the collagen cap that is protecting the plaque underneath it from rupturing into the lumen of the arterial wall. And this inflammation is getting caused by the immune system. One of the cells that is generating this inflammation is called a macrophage, and it's forming what is called foam cells, and foam cells cause inflammation. And then we also are looking at a measurement of myeloperoxidase. And this is when there's vascular inflammation, again, within the vessel wall, but it also includes the point at which the vessel wall might have fissures or erosions, or the cap might be degrading. And this is an indication of potential plaque rupture. We do some nutrient testing that is indicative of heart health, and we can look at the effect of dysbiosis on heart health. So the omega check is a test that's measuring your anti-inflammatory omega-3 fatty acids and your pro-inflammatory omega-6 fatty acids. And you want to know the ratio of them. And so if your omega-3 fatty acids are low, you know that you can increase your diet with nice fatty fish like salmon, and with walnuts, or you could increase the amount of fish oil that you're taking. And the omega check will also give you values for EPA and DHA. So these are two components of omega-3s, and you can supplement differently if you know which one is low, which is very nice. TMAO is a very interesting marker that indicates gut dysbiosis that has actually affected the cardiovascular system. So in this case, you would prioritize the gut to a higher extent if TMAO was elevated along with dysbiosis being present. So I just want everyone to know about my signature program called Restore and Rebuild 100 Days to Healthier Bones program. It's 10 weeks of live content, 10 weeks of live Q&A sessions. There's a lot of resource material. There's protocol tools and interactive lab assessments. And this really goes through what I do in my practice, which I've had a great amount of success with. Our next cohort starts March 1st, 2025. It's held on Thursdays at 3 p.m. Pacific, and I would love for you to join the program if you haven't already registered. And you can find the more information about the program at themillmanclinic.com/R&R. And it is only $797, which is an early bird price until February 24th, 2025. So let's look at the testing options that you have available for getting this testing done, whether you're in the program or you're not. So many of these tests can be ordered by your own primary care or functional medicine doctor. And if you're a patient of mine, and you can only become a patient of mine if you are a resident of the state of California, then I can order these tests for you. And your third option is for you to order these tests on your own through a direct-to-consumer testing company. And we've vetted out several companies that offer these tests to you. I've designed an interactive testing tool to help you get your essential lab tests for bone loss organized. This will allow you to input your lab test results and the dates that you got them done and compare them to the optimal ranges that are on the testing tool, which is different from the ranges that you might see on a lab slip from LabCorp or Quest. And then you can get a list of the tests that you still need to complete. I invite you to use this tool. I've had many of my patients use it, and also a lot of my students from the Restore and Rebuild 100 Days to Healthier Bones program have used this tool, and I really have great reviews on how much people think it's useful. Once you have filled out the interactive testing tool and identified the tests you need to do, the first step is to request that your doctor orders the tests. In order to expedite this process, we've provided both the LabCorp and Quest codes and the conditions for the test, including whether you'll need to fast or avoid taking foods or supplements before the tests. This is included in the program, but it's also available on its own for $27 in our lab testing guide. If your doctor is not willing to request the tests, we have vetted direct-to-consumer laboratories that you can use to request and purchase the labs from. We have all the codes figured out for you from these vetted companies, and in most cases, we have the links for you to use. Hopefully, your doctor will request many of the tests, and this will be a short list for you that you will have to purchase. In the program, I show you how to interpret these tests. Life Extensions is one of the highly vetted companies that we use, and Life Extensions has an economical panel for $149 with many of the tests that I recommend. And so this is the Life Extensions code, and this is the link for the Life Extensions panel. Tests that are not covered by the Life Extensions panel that are specific to bone markers, which would be in high priority, including the CTX, the P1NP, PTH, and 24-hour urine calcium. Unfortunately, Life Extension no longer offers these tests, but you can get them from Ulta Labs. So I have provided the Life Extension and the Ulta codes, as well as the prices and the links for you to purchase these tests on your own. Blood tests for hormones through Life Extensions is given here. We've also included the code from Life Extension and the price. The ZRT panel, hormone panel 3, which includes cortisol, is given here that you can buy through DHA, and you'll have to call to order that. And also the Dutch Plus information, including cortisol, the cortisol awakening response, the hormone metabolites, can be purchased through DHA, and we have the link for that as well. We have contracted with Michelle Ross to provide a 5-Zoomer bundle for $600, and we have given you the link for this functional medicine lab test. And you have as an option for the foods that you want to look at, including wheat, grain, dairy, nut, peanuts, egg, corn, soy, seafood, and lectin. Actually, I think this is a mistake. Seafood is no longer offered. A GI map can be ordered through Direct Labs, and you can get the GI map or the GI map with zonulin. I highly advise to get the GI map with zonulin because that's a leaky gut marker. And so through Direct Labs, you can get it for this price at this link. Through DHA, you can get it for this price through this link. For the comprehensive cardiovascular risk test that we just talked about, Ulta has a large panel that is approximately $509, and it's got a lot of the tests that we just discussed. And this is the link for it. And Ulta also has a singular test available, like the Omega Check or the TMAO. If you're interested in those specific ones, you can order that through Ulta. We will have a lab testing guide just for the heart codes available very soon. And we'll be offering that through an email. If you are in the program or a patient of mine and you need help, we're here for you. You can call us at the clinic and we'll be glad to get back with you as soon as possible. We also have the lab testing guide available for $27. And if you are a participant of the Restore and Rebuild 100 Days to Healthier Bones program, you get this for free, but it is also available for sale. And in this lab testing guide, we have a full set of LabCorp and Quest, Life Extension, Ulta codes, as well as DHA, Direct Labs, and the link to Michelle Ross's site for the Food Zoomers. I have the link here to purchase the lab testing guide, but we're also offering it through an email. So I hope that you found that this essential lab testing for Unbreakable Bones webinar has been helpful to you. And I would love for you to join the program. If that's not right for you, then I hope that you will listen to another webinar or podcast of mine, because it is my mission to help women and men with bone loss identify their root causes for why their bones are thinning and help them to stabilize and reverse their bone loss so that they can lead a full and active life that they desire.
Wow, Dr. Millman, this is so great. And now people have the information and they have the tools and they can do this. If they have an integrative or functional medicine doctor, they can, put this into what they're already working with. But if not, the good news is that you have a program and they can work with you. And, it's really interesting because I don't know how many years ago, I think it was when I did my first summit. Now I've done 4. And the first summit, Dr. Millman was one of the speakers. And so many people said to me, can we clone Dr. Millman? Is there a Dr. Millman in my state? And, she lives in California, but only works with people as a physician in California. So I said, Dr. Millman, is there any way you can create a course or a way that you can work with people in groups and we can help people figure out their testing and their root causes so they can do this type of integrative care? And how many years later, a few years later, you create, why don't you just share about what you created? Because it was funny. We talked about it and then all of a sudden this amazing course appeared. So, and that I've been part of as well. So you want to just talk about what you did and what's happened since the few years that you've been doing this?
Yeah, sure. Of course. So what I wanted to do is really replicate what I do for my patients in clinic. And I have had so much success in my clinical practice with a very, very low fracture rate among my patients. And I do take this very integrated approach, looking at as many factors as I see in the research that is scientifically backed that is related to bone loss. And I do a fair amount of testing. And so I wanted to share that with people who really didn't have access to someone like myself. And so I put together this program, and it is it's a hybrid program where you have a lot of the training is online, and then we have Zoom Q&As. And so that then you can ask me questions about the materials. And so then you really have the opportunity to immerse yourself in this material and ask me questions that can help you interpret your own lab tests, get your own lab testing, and that you can really improve your root cause factors for bone loss and improve your health. And hopefully you can also strengthen your bones at the same time.
Yeah, it's just been so wonderful. And I've been part of it. I teach 2 of the classes, and you've really created a whole community. I think the best part is the question and answer part, that people really have gotten to ask you questions. So they do the testing and then they can come back and, and you help them so everybody can sort of move forward. So we have so many people in both of our communities, and it's just been so great because this is for the person, this is how I look at it, for the person who wants to dig deep and doesn't know where to go and can do this with your help, with the help of a integrative physician who's done this for 15 years effectively. And it's just been great. I can't even tell you, because now, how many years we've been doing this? Is it 2 years, Dr. Millman, now?
A little bit more than that, almost 3.
Yeah, so you've had how many classes? It's been 3 classes?
This will be the 4th.
Will be the 4th, yeah. So 4 classes, and 4 times people are like, thank you so much. I can't even tell you. Thank you so much for introducing me to Dr. Millman, and on and on and on. So I'm just so happy, and it's just great. I just love when we empower people to be able to make these positive changes in their lives. And you and I are so on the same page with this. And they get better. And then they find other things that they didn't know, and other things improve too. That's why, I always say a blessing in disguise, because all these other things improve when, as they're working on the root causes. So you'll give them the classes. If you're listening to this in real time, tell them when the next class is starting, because it's relatively soon.
The next class starts on March 1st. And they'll be held on Thursdays at 3 p.m. Pacific. And so we have 10 weeks of training, and we have 10 weeks of Q&A, and we have 4 integration weeks. And so you get the training they get released on Saturdays, and we have our Q&As on Thursdays. So you have plenty of time to listen to the material, to get your questions thought out. And then we really do support each other. I think that is another thing where I've heard from students who say, yeah, I've got my bones buddies, we still talk to each other, and we call each other up, and a few just live a couple of blocks from each other. So now they're socializing. And so, that's a really nice thing to hear, that people are gathering strength from having shared experiences, and by, having shared challenges.
Yeah, no, it's great. And it's fun. I teach 2 of the classes on exercise and also stress and happiness, which we know is so important. So it's just so much fun. And it's a really in-depth program. So it's the type of program, if you're a person that wants to do everything you can do and really learn so that you're empowered to make the right decisions and have really the best understanding you can, then to me, that's the person. Am I right about that? It's not someone who, who's not willing to take an active role in it, because you'll learn a lot and you'll be able to participate. Anyway, and so you give all of everyone in my community a little discount. You want to share about the discount?
Yeah, absolutely. So there's $100 off the price of the investment for the course, and it's called Restore and Rebuild: 100 Days to Healthier Bones. And Margie's code is HappyBones25. And so if you go to the place where you'll learn more, which is the millmanclinic.com/R&R, and is ANDR, then you'll be able, if you decide to register, and then at checkout, you'll be able to put in the code and get $100 off of the price.
Oh, great. So anyway, I wanted you back because this testing is so important. Whatever you decide to do, I think it's important to really incorporate the information that Dr. Millman talked about, because, this is what it's all about to me. And this is where I've seen really changes how your treatment goes. Because as we know, this is not the same, it's not one size fits all. So I'm just so grateful to you for all the things you do. And is there anything else you want to share before we end, Dr. Millman?
It's really my mission to, and my passion to help women and men with bone loss. And because I feel that it is an opportunity. I mean, we've both shared this many times, but it is an opportunity to not only strengthen and make your bones more resilient, but really to help your overall health and to prevent other diseases. And we're talking now about with cardiovascular disease, we're talking about preventing the number one killer of women and men in the US. And they're so linked that you can't think about one without thinking about the other. And so, again, a really great opportunity to be proactive and, really take control of your own health.
When you do, who doesn't want to live vibrant, healthy, long life, which is all possible. And so I think this is so great. So thanks again for being here. It's always a pleasure. And I look forward to, well, I know I'll see you soon. So we'll be together soon.
Thanks, you too.
I hope you enjoyed my interview with Dr. Millman as much as I did. Make sure to check out her testing tool. It's really wonderful. And all the links will be in the show notes. So thank you so much for tuning in, and I look forward to seeing you on the next episode.